So, this week, I know we're focusing on mental health and the workplace, more about stigma and discrimination in regards to those with mental health conditions and how that affects their ability to engage or be employed. But I found an article which I thought was interesting in regard to things that are happening in the workplace that are affecting people's mental health well-being and maybe causing mental health conditions. So the title of the article is Workplace Stress, a Neglected Aspect of Mental Health Well-Being. And workplace stress is defined by the World Health Organization as the response people may have when presented with work demands and pressures that are not matched to their own knowledge and abilities and which challenge their ability to cope. And it can be caused by poor work organization, poor management, unsatisfactory working conditions, and lack of support from colleagues and supervisors. While workplace stress, stigma, and attitudes towards employees suffering from stress or mental illness have been researched, it still remains an often neglected aspect across different industries and countries. So this article was written from a man that lives in India. So his perspective is a bit from that country, but he does address how it affects different countries worldwide. So he goes on to talk about how there have been laws that protect human rights of employees at the workplace. However, the execution of the policies have been variable and suboptimal. Moreover, low and middle income countries, where one has the largest population in working age groups, continue to lag behind in conducting or identifying suitable interventions, and they often do not have adequate policies to prevent workplace discrimination and discrimination for employees with mental disorders that may be existing already or may be caused from the working conditions. So he mentions that workplace related stress can be addressed through evidence-based interventions. And there is a cross-sectional study he mentions that was conducted across 35 countries, including India, and reported that about 2/3 of employees who had suffered from depression either faced discrimination at work, discrimination while applying for new jobs, and that both anticipated and perceived discrimination was more prevalent in high-income countries compared to lower-income countries. Both perceived and anticipated discrimination are major causes for people suffering silently at the workplace and not seeking proper care. This is a major issue for people seeking care for mental disorders, as it adds to stigma related to help seeking and increases the treatment gap. The proportion of those people who actually receive adequate mental health care is not enough. If organizations are made aware of this, they can encourage staff to seek the appropriate mental health care as needed, improve care for persons with mental disorders, but also to a situation where employees are comfortable discussing their mental health issues with appropriate staff and take actions early on so that more severe mental disorders do not manifest. He goes on to say that another risk factor besides depression or anxiety as an outcome of stress are physical disorders such as hypertension and diabetes. Sexual harassment and bullying at the workplace is another work-related stress. Women and those at a lower hierarchy are at increased risk. Organizations should be cognizant of this and take active measures to ensure that the workplace is a safe and secure place for all workers. Although there are specific laws to prevent sexual harassment and safety at workplace, sometimes these guidelines and processes are not followed, which increases stress in the workplace, which increases stigma for mental disorders. So it's kind of all tied together. He also mentions how there has been research that focuses on the alleviation of symptoms and risk factors associated with workplace-related mental disorders. But there has been less emphasis on being placed on gathering evidence on how mental disorders can affect performance and absenteeism, and how interventions have resulted in improvement of work performance and absenteeism. So, there are guidelines in place that have been recognized by the World Health Organization, and they have listed key factors that are related to stress at the workplace and advocated for guidelines to remediate them. So some of these factors include increased stress at the workplace, which is due to workload, lack of participation and control in the workplace, monotonous or unpleasant tasks, role ambiguity or conflict, lack of recognition at work, inequity, poor interpersonal relationships, poor working conditions, poor leadership and communication, and conflicts at home and work demands. So they provided 4 key steps which can help to alleviate some of this stress that is experienced. The first step is analyzing the mental health issues. It is essential to have a clear understanding of not only the prevalence, incidence, and risk factors associated with workplace stress, but also to have a better knowledge about the cost that this may have. This process, this part of this step, may need gathering, people may have to gather data through surveys or collating data with the Human Resources Department or health records. But if this does take place, they can develop the policy, which is step 2. So per the World Health Organization, they state that a policy can be developed once the initial knowledge gained through the first step is available. The primary objective of such a policy can address concerns of all stakeholders and adhere to the organization's vision and mission. Multiple meetings with different stakeholders to identify key components can take place, and this is a continuous process. The third step is developing strategies to implement the policy. Care should be taken to identify the key strategies that can be implemented, and processes can be in place to implement such strategies, including budgeting and what ways that they feel that would be the most effective and far-reaching for their employees. But that basically leads to step 4, which is implementing and evaluating the policy. They say that one major drawback of many policies is that they lack a formal evaluation. This can be built into the system. But they state that if these steps are taken, then mental health stigma and mental health disorders and stress that can cause mental health disorders can be addressed in the workplace. I like this article because I like that it has a tie to the material that we're learning about this week, but it looks at it more from a perspective that I think that a lot of people go through in the workplace. And I really think that it comes down to who you work for. And I feel that some organizations don't take their employees' mental health and well-being into consideration and consider that in the fact, like, for example, when we're treating patients, it's very important for us to have a good sense of well-being when we're treating our patients. Because what happens in our home and school and in our personal lives can affect the way that we are able to think and to provide the best treatment for our patients. So I hope you enjoyed the screencast, and